Morning and a very warm welcome to the second day of APAC HealthTech Innovation Conclave. Just to give a brief, we had an amazing inaugural session yesterday in the day one with the presence of Honorable Health Minister of the Government of Chhattisgarh, Sri T.S. Singh Dio, besides various other dignitaries and leaders from the healthcare industry from across the country. We had series of presentations and interesting panel discussion on very relevant and themes that are very much needed in these times of COVID. Let me tell you about we today where we also had an opening ceremony, and now we are joined by a special guest from the state of Mizoram. So this APAC Health Tech Innovation Conclave presented by Dell Technologies, Microsoft, organized by APAC News Network, also supported by Ognito and associate partners as Doxiva and Viveo. So, join me in welcoming our special guest who is going to give a state perspective on how the technology is being used and being integrated by the state government, especially the emerging technologies such as artificial intelligence, machine learning, blockchain, robotics, and other emerging technologies for improving healthcare delivery. So, uh, join me in welcoming our special guest from the state of Mizoram, Dr. Zorinsangi. She is the state nodal officer with the Director of Health Services, Government of Mizoram. Thank you very much, Dr. Zorinsangi, for joining us.
Thank you, Sudhir. Okay, thank you. A very good afternoon to you all. Today I shall be talking on the topic of the state perspective, how technology is playing a vital role and improving the public health landscape beyond the pandemic. I thank the organizers for giving me this opportunity, and I'm glad that I have a chance to interact with you all, though of course virtually. I shall be giving a talk from the state perspective, that is Mizoram state, and it will be like talking from the field where we have our experiences and our problems, and in the process of implementation of public health programs. First of all, I would like to say that technology in public health seems to have less importance in comparison to the curative approach where technology has been used significantly in the form of medicines, medical equipments, and diagnostic devices. Public health, on the other hand, mostly looks into the primary health care, the preventive and the promotive care. That is mainly improving the health seeking behavior of a person, the prevention of diseases, and the health system strengthening. But technology has always played an enabling role in public health. It is increasingly assuming a central role in many public health interventions. Unfortunately, the adoption of technology in public health has not kept pace with the advancements in the field. Cases of successful usage of technology in public health interventions are few to name and are not utilized in their full potential. So, in this session, I shall focus mainly on digital technology, which has been insufficiently utilized here. Even before the pandemic in public health, technology has helped us in planning, in monitoring of activities, and the evaluation of certain programs. The digital technology platform has helped us in such a way that it saved time, it saved money, which is very essential in a low resource setting like our state. So far, the supply chain management, the DVDMS software, the drugs and vaccine distribution management, a platform for the supply management of medicines and drugs had been rolled out. And recently, we are using this after the pandemic, when we are about to roll out the COVID-19 vaccination. We have this CoWIN portal, which is being used successfully from that time, and it is going on till now. And certain softwares are in place in the public health setting, like the FPLMIS, which is the family planning, logistic management, information system, the NCT apps, and there are certain uh, apps which are being rolled out by the Ministry of the Health and Family Welfare. Those apps were very significant, but one of the thing is that having a correct data, the correct data needs to be fed and the data needs to be completed. So uh, maintaining and feeding the data is a challenge. It's still a challenge which is going on also. And I would also like to mention that further in the during the pandemic, there are certain things which we have to resort to because we don't have much options. So one of the things which we don't usually have are with the virtual meetings, the virtual conferences with the help of certain apps like video conferencing, which we held. We have to as we don't have other options, we have to conduct the training virtually. It has to certain guidelines uh, have to be introduced. Certain have to be in place at the district level and over to the block level at the periphery. So we were using the virtual training, but there are certain limitations. Like the quality of the training was also in doubt. Whether on the other end there is a full participation also it cannot be ascertained, and there is a like in a role like in a remote place like here we used to have disturbances due to the connectivity also, and the quality of the training was at times compromised. But considering the urgency and the time and money it saved, it may outweigh the disadvantages also. And to mention that, like one thing I would like to mention that is that not everyone in the system, like in the healthcare, when we think about all the workers, including the doctors, the nurses, the lab technicians, and even the ashas in mind, not everyone is techno savvy. So the pace of using a digital technology can also be sometimes uneven, and sometimes the acceptance of using this technology can be very poor at times. Sometimes there is a halo, there is a gap, but even then something is better than uh, uh, it's so it cannot replace everything. So there are certain times when it cannot be equal to the proper classroom teaching, but overall during the pandemic and beyond, it has a very great prospect which I would like to mention. And one thing where we use the digital technology extensively was the reporting system from the facilities, from the COVID care facilities, from our own public health facilities. Also, the real-time reporting was also distinguished as it was fast and efficient. But but there is a certain dedication and effort it requires. It can be very exhaustive in the long run also. So the advantage of it being paperless and environment is also a point to keep in mind. The and some of the challenges are the still which are still concerning like which are still which we have still in doubt is regarding the quality and the consistency of the data are also still a concern. And another area where the digital technology is successfully used out here in our state is the IEC component, where uh, which is going on before the pandemic, during the pandemic, and which has a future prospect is that like we are using IEC as a major component. Digital technologies used in this component, it has become a very important medium for raising awareness and communication to the public. The advantage is that it is fast and it can, but one of the disadvantages is that it can never replace an interpersonal communication, though. But in certain ways, it can be superior in certain matters with the graphics and all. It can give a very good message also. So, like when we talk about anything, there are two sides of a coin. It can have its disadvantages, and at times one of the problem in during the COVID-19 is also when we want to give a good message also. Sometimes when it goes through digitally, the message can be wrongly interpreted also, even though it's not the intention from the point of giving like from our point, though it can be like wrongly interpreted also. That is one of the disadvantages. And what we can see at times also, that I would like to state it. And one thing which I would like to state is that technology is very important in epidemiology, like in the digital epidemiological surveillance system. uh, you know that one of the core step in public health activity is to put the data during the COVID-19, also the data with respect to COVID-19, with respect to the time, place, and person. And we need to identify the risk factors so as to guide us for suitable interventions. So the data visualization support is one of the most important way of communication that actually translates the data into a layman language, so the people, the public gets informed and support and it's even support the policymakers in redefining the interventions which we came out with. And one thing which we observed was also that the COVID-19 dashboards provided by many uh, organizations show the responses during the pandemic. And one thing which is still a concern is the consistency of and the quality of the data collection also has to be kept in mind. And I would like to talk in from the prospect of Mizoram also, like how we use technology during the COVID-19 pandemic, is that we have come up with two very important applications from the home, from the in coordination with the health department, the disaster management, the police department, and the home department. There are certain apps which have come in place during the COVID-19, which is still in place. Also, one app is the Sunu app. It is like Sunu. It's in Mizo. It is like a footpath. The meaning is like a footprint. So it is an app. It is which we use in contact tracing. It can be used by a smartphone users in shops, offices, and houses. So it is a contactless way of making a line list of those who have visited a particular place. So the application works in two ways. It logs in visitors to a particular location, and it has a logging of location history also. So the app which was in place was also used extensively, and it is very promising. It can be, I know in some other states also many other kind of software or any apps are used also, but then it can be it was also very helpful, rather than writing with like your name in a pen or with a notebook. But there are still practical issues which are concerned also, like the extent whether people are using, how much extent that people are actually using it. That is also another concern. And one app which really help us in fighting the COVID-19 is that, like, one thing which I would like to mention further is that our state, Mizoram, though it is remote, it is located in the border of Burma and Bangladesh. We are very successful in fighting the COVID-19. So far, I would like to state that till now, in a population of around 10 lakhs out here in Mizoram, we have a total of 4,451 cases so far. Until now, there are active cases of 13, and the number of deaths due to COVID-19 is only 11, which is the smallest in all the state of Mizoram. So, like, all this technology has helped us in achieving this. One thing which I would like to mention is that Mizoram is taking a very proactive action in combating the COVID-19. So one of the app which I would like to state about is somewhat similar to the Arogya Setu. The name of the app is mCovid. So it has updates of the COVID-19 cases, the list of COVID-19 helpline numbers. It has updates on the advisories, a portal for seeking entry passes into the state of Mizoram when there was a restriction into movement. A pass has to be made if they have to enter Mizoram through road by air. And when curfews were imposed at night time, the app helped us in seeking the traffic passes also. There is a platform for registry of the stranded migrants from different states also. They can register themselves. And then one task force which we use is that we uh, during the COVID-19, it was the action which we the thing the action which we did was very proactive. Everything was very decentralized. So we have a task force at the a very small level, like a locality level, at the village level, the task force comprises of the health personnel as well as local leaders, the NGO leaders. So those task force also, they really helped in contact tracing as well. They helped in helping those who are in need, those who don't have food due to restriction of movement. Also, these people really helped. They were actually the frontline workers. So all those task force were also registered through this portal, and through this M-COVID, we are maintaining, monitoring those who are on quarantine. Also, there is a portal for registering yourself if you want to volunteer for the COVID-19 also, and if you want to make a donation for the Chief Minister's Relief Fund, also you can do that from that M-COVID app. So it was very helpful. It was like a shortcut to the every activity that was happening during the lockdown in Mizoram. So that was very helpful, and that was through with the help of the good technology which was in place. And one thing I would like to talk about is there are certain limitations with respect to the use of technology, which I would like to talk about. There can be barriers in its full implementation. It can be legal, ethical, or privacy barriers. So there was this has all the privacy barrier also has come into mind when the Sulnu application, which we use in contact tracing, was placed. Also, there were certain issues which we kept in mind. So that was one thing. Also, there can be barriers in terms of the organization. Also, like I had stated, barriers from the workforce, and also that can also be possible when we use the technology. And and as the future of public health is likely to be increasingly digital and more applicable, it will be more applicable when we fight against the COVID-19, as well as other diseases also. Uh, and for the public health measures, for the outbreak response also, the in the surveillance also, in the case identification, in the interruption of community transmission, and there and the for communication of the public, for strong public communication also, the technology has been a backbone in the public health action. So monitoring of all these measures are implemented, and then we can know about the impact of anything, of any uh, through digitally, and any action through digitally, through like the outcome, like we can know the incidence and the mortality also. We can keep update with all this report system also. So that is very essential also. And yes, beyond the pandemic also, uh, since the public health activities are information based, and for routine health provision also and monitoring also, the activity reports from the peripheral ends. Is the connectivity okay? Okay, thank
Yeah,
you.
yeah, absolutely.
So the provision and monitoring, and yeah, and the access to the activity reports from the peripheral ends, like from our peripheral facilities also, it needs to be analyzed through technology and has to be formulated into an action plan. So uh, one thing which there is still a gap out here is that the connectivity problem, and there is still a hesitancy among the workers, and sometimes it can be user friendly also. So it will be more beneficial if all the workers were techno savvy. It will be more promising in the near future when the older workers, like those who are nearly retiring, also if they phase out, we might be able to use the technology optimally also. And there are certain areas where digital technology needs to be introduced also, like in the surveillance of the communicable diseases as well as the non-communicable diseases. We need to have a new technology so as to show graphically also how the trend of any illness or any signs and symptoms is increasing. And one thing which I would like to mention is also like for routine healthcare checkup, like antenatal care also. One thing, like we know that in marketing also we keep receiving messages regarding sales through emails and text messages like that. Text messages to pregnant women, patients on treatment, like at the time for taking drugs, and additional information such as regarding nutrition, doctor's appointment, reminders, and urgent health alerts are some innovations which we are looking forward to. We might be able to use it in the future also, that will also be beneficial. And and one thing which I would like to mention is also, if we are going to introduce any new technology or a digital or anything like equipments or medicines, it should be well assessed beforehand so that it will have long time sustenance. Also, that I would like to mention it, that is very important. Also, we have to think about the affordability, also the quality, the simplicity, also, so that it can be used by even the at the remote area, by even by our ashas also, whether it is really applicable or not also, and if there is a chance of scaling up also, are some of the criteria which we have to keep in mind when a new technology has to be introduced. And in conclusion, I also would like to state that we need to harness digital technologies to support the public health responses to any disease, whether the COVID-19 or any disease worldwide. We need to have population surveillance, contact tracing. Need to evaluate the intervention also on the basis of the mobility data also, and all those things we need to communicate with the public. So, as the technology is evolving, its role in public health, from the crisis and disasters to the population health and wellness, we need to see that there is a great scope, and we know that no doubt it will extend. And I look forward to see that how it will, this new and new innovation tools will help to improve the public health narrative as well. One of the limitation which I have to mention lastly is that while we rely on the we need to rely on the telecommunication infrastructure and the internet connectivity. It really becomes
Yes.
a challenge when such a provision is not possible due to the remoteness of an area like our state. So that has to be kept in mind also. And I have a few things to say. When the spread of COVID-19 has exposed the need for the government to accelerate the evaluation and the adoption of any new technology, I believe that the future of public health is likely to be increasingly digital, and and we need to realize the importance of technology in this field, and it has become very urgent. And uh, but one thing is that the digital technology cannot work in isolation, so we need to integrate it nicely with the existing healthcare system also, and there has to be a successful implementation strategy. It will also require coordination with the government and with the patient group also. So uh, lastly, we all, as I had stated at the beginning of this talk, also, public health has always been underfunded compared to other areas of health. So it will need a substantial investment also for the workforce education and the skills training also, so that we'll be able to have digital public health leadership also. And lastly, in Mizoram or anywhere where the smartphones and any technology is used extensively, there is also, and where there is a progress in the digital field also, there is a scope for turning this opportunity into accelerating the public health action, which will eventually lead to a very beneficial outcome. So that is what I would like to say so far. Okay, thank you so much.
So that was Dr. Zorinsangi from the state of Mizoram. We are glad to know that the COVID has been under control with the strict measures that the state government in Mizoram is taking. While some of the states are still struggling, there is a spike. It's being said there is a second wave that's likely to strike. In this scenario, we are glad that the Mizoram state government is setting an example by keeping the COVID under control. Despite challenges of funding, despite challenges of network, the state government is doing well. We're glad. Of course, there is a scope of the public-private partnership collaboration to a larger extent, so that whatever the fund crunches are there, the financial crisis, that as you have rightly mentioned, it is the public health is always underfunded. So there are other alternatives which we need to look up to. So with this, thanks for sharing us what's happening in the state of Mizoram, how the state health department is taking care of various aspects. Despite challenges. Thank you very much, Dr. Zorinsangi, for joining us. And we would be coming up with a conference report. We would be document whatever you have mentioned, and it would be reaching you and your state government soon. Thank you very much for joining us.